Welcome to episode 63 of the Pulse of Physiology. I'm your host, Dr. Jim Davis, and today we're discussing glomerular filtration rate, or GFR. GFR is the gatekeeper of renal physiology, and by the end of this episode, you'll understand how GFR is determined, the role of Starling forces, and some factors that increase or decrease GFR. So let's get started. GFR is the volume of filtrate formed per minute by the kidneys, typically 120 to 125 milliliters per minute, or about 180 liters per day. Since total plasma volume is approximately 3 liters, this means the kidneys filter plasma about 60 times each day. Now, GFR is crucial for maintaining fluid balance, waste removal, and blood pressure regulation. It's influenced by the net filtration pressure, which you might recall us talking about during the Starling forces episode. This is the balance of filtration and reabsorption forces. GFR is also influenced by filtration membrane permeability. And so this is just a measure of how easy it is for substances to pass through the glomerular capillary walls. Finally, there's the total surface area for filtration. This is determined by the number of functional nephrons available for filtration. If there's more surface area, then GFR will be higher. The glomerulus is a bundle of capillaries where filtration occurs. Blood enters through the afferent arteriole and exits through the efferent arteriole. The afferent arteriole's diameter is larger than the efferent arteriole, which creates high pressure that promotes filtration. Filtration of the glomerulus is governed by Starling forces, which include hydrostatic and oncotic pressures that drive or oppose filtration. Similar to just the general Starling forces that we talked about a few episodes ago, we've got filtration forces that are glomerular hydrostatic pressure and Bowman's capsule oncotic pressure. Glomerular hydrostatic pressure, which is normally about 55 millimeters of mercury, is the pressure exerted by blood inside the glomerular capillaries. This causes fluid to be pushed out of the glomerulus and into Bowman's capsule. Then there's the Bowman's capsule oncotic pressure, which is normally around 0. This is due to the osmotic pull of proteins in the Bowman's capsule. However, since proteins are generally not present in the filtrate, this value is normally 0. However, if there are proteins present, these proteins would pull fluid out of the glomerulus. Then we have the reabsorption forces. So we've got Bowman's capsule hydrostatic pressure, which is about 15 millimeters of mercury. This is the pressure exerted by fluid already in Bowman's capsule, and this pushes fluid back into the glomerulus. Then we have glomerular oncotic pressure, which is normally about 30 millimeters of mercury. This is due to the osmotic pull of plasma proteins in the glomerulus, and this force pulls fluid back into the glomerulus. If we have a positive net filtration pressure, this means filtration is occurring. Another way to look at this means that the filtration forces are greater than the reabsorption forces. Now, if we change any of the Starling forces, this is going to alter GFR. If we increase glomerular hydrostatic pressure, we'll increase GFR. If we increase Bowman's capsule hydrostatic pressure, we'll decrease GFR. And this can occur due to kidney stones or urinary obstruction. If we decrease glomerular oncotic pressure, this will increase GFR. So this can occur if we have liver disease or something called nephrotic syndrome. Basically, anything that decreases the amount of plasma proteins in our glomerulus. Vasodilation of the afferent arteriole will increase GFR because we're allowing more fluid into the glomerulus, which will increase the hydrostatic pressure. However, if we vasodilate the efferent arteriole, this will decrease GFR. Basically, the efferent arteriole acts as a drain, and if the drain is bigger, more fluid will be able to leave, which reduces the pressure. Since GFR influences urine production and blood volume, small changes can have major effects. If GFR is too high, then there will be excessive fluid loss, which can lead to dehydration. However, if GFR is too low, then waste removal will be insufficient and there can be a buildup of toxins. So to summarize, GFR is the amount of filtrate produced per minute. Filtration of the glomerulus is driven by hydrostatic and oncotic pressures. Changes in afferent and efferent arterial diameter can alter GFR, and GFR regulation is essential for maintaining homeostasis. So that's it for episode 63. I hope this episode has clarified how GFR is determined and why it's crucial for kidney function. Come back next time for episode 64, where we'll talk about the intrinsic control of GFR and how the kidneys regulate their own filtration rate. Until then, keep questioning, keep exploring, and stay curious.